This medication is a type of antihistamine that is used to help stop the eyes from itching due to allergies, also known as allergic conjunctivitis. It works by blocking the effects of histamine, which is a substance in the body that causes allergy symptoms. This medication can be used in both adults and children, and the usual dosage is 1 to 2 drops in the affected eyes twice a day. It is best to use this medication at the same times each day to help maintain a steady level in your body. When using Epinastine Hcl drops, it is important to follow your doctor's instructions and use the medication in both eyes, usually twice daily. Even if your eyes are not irritated or itchy, it is important to continue using the drops during times when you may be exposed to allergens or pollens that can cause allergies. If you wear contact lenses, be sure to remove them before applying the drops, and wait at least 10 minutes before putting your lenses back in. To apply the eye drops, make sure to wash your hands first and avoid touching the dropper tip to prevent contamination. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Then, hold the dropper directly over your eye and instill the prescribed number of drops. After applying the drops, gently close your eye for 1 to 2 minutes and apply gentle pressure to the inside corner of your eye to prevent the medication from draining out. Try not to blink or rub your eye. After each use, be sure to replace the dropper cap and do not rinse the dropper. If you are using other eye medications, wait at least 10 minutes before applying them, and always use the eye drops before eye ointments. If you experience burning or redness in the eye or a headache, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While it is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Always follow the advice of your healthcare provider and take the medication as directed. Before using Epinastine, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain ingredients that could cause allergic reactions. Be sure to discuss your medical history with your doctor before using this medication. If you wear contact lenses and your eyes become red or irritated, it's important to consult your doctor about using them while using Epinastine Hcl drops. After applying this medication, your vision may become temporarily blurred. It's important to avoid activities that require clear vision, such as driving or using machinery, until your vision has cleared. If you are pregnant, you should only use this medication if it is clearly needed. Be sure to discuss the risks and benefits with your doctor before using Epinastine Hcl drops. It is not known if this medication passes into breast milk, so be sure to consult your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions when using Epinastine Hcl drops. This is because certain medications may alter the way Epinastine Hcl drops work or increase the risk of experiencing serious side effects. It's crucial to keep a record of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and make sure to share this list with your doctor and pharmacist. It's also important to always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. This medication is for the eyes. It is used to treat itching of the eyes caused by allergies. This medication is an antihistamine. It works by blocking certain natural substances, histamines, that cause allergic symptoms. If you forget to take a dose of Epinastine Hcl drops, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Continue with your regular dosing schedule and do not take a double dose to make up for the missed one. Make sure to store Epinastine Hcl drops at room temperature and keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember to always handle medications with care and follow the proper disposal guidelines to ensure the safety of your household and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.